Hello, I'm Cam Patterson, Chancellor of the University of Arkansas for Medical Sciences. Today, the UAMS Faye W. Bozeman College of Public Health released new projections of the effects of the coronavirus in Arkansas, just as they have done every 2 weeks for the last several months. These forecasts rely on data provided by the Arkansas Department of Health and on conditions remaining the same. It's important to note that the current models are assuming no changes in the rate of spread due to holiday gatherings. If Arkansans participate in large gatherings over the holidays, the numbers will likely be higher. In today's report, the 15-day forecast continues predicting an increase in the number of daily cases, hospitalizations, and deaths due to COVID-19. The models predict cumulative confirmed cases in Arkansas of nearly 184,000 cases by December 28th. If we include probable cases, that number increases to more than 220,000. The models predict almost 11,000 cumulative hospitalizations, nearly 3,500 intensive care patients, and more than 3,100 cumulative confirmed deaths by December 28th. If we include probable COVID-19 deaths, Arkansas has already surpassed the number predicted by the models. Every single county in Arkansas reported new COVID-19 cases in the last 2 weeks, with 6 counties having 2-week change rates greater than 100%. Projections continue to be that Arkansans between 35 and 59 will experience the highest number of COVID-19 cases. Young adults 18 to 34 will have the second highest number of cases. These two age groups will make up around 2/3 of the COVID-19 caseload in the state. The greatest number of hospitalizations continues to be in adults between the ages of 60 and 74. Children younger than 17 continue to have the lowest number of hospitalizations. However, that number is increasing. The long-term model suggests the pandemic will peak in April of 2021 with approximately 27,000 active infections. Now, I invite Dr. Mark Williams, Dean of the College of Public Health, to explain the latest models in more detail.
Thank you, Chancellor Patterson. Hello, everyone. I'm afraid there's very little positive in this COVID-19 report from the College of Public Health. The data are showing some unsettling trends we can expect to see in Arkansas over the next 2 weeks. The 15-day forecast of cumulative confirmed and probable cases for December 28th is 220,152 cases. The forecast is telling us new cases will increase by 35,272 over the next 2 weeks. What this means is we will see a 20% increase in the number of confirmed and probable cases by December 28th. To put it another way, in the next 2 weeks, new cases will equal a fifth of the entire caseload in Arkansas from March 11th through December 14th. The map on this slide shows the number of COVID-19 cases in the last 2 weeks per 10,000 population for each county. The 10 counties with the highest per capita rates in the last 2 weeks were Drew, Desha, Bradley, Greene, Poinsett, Clay, Yell, Mississippi, Lee, and Dallas, which all had rates greater than 100 per 10,000 population. This map shows the relative change in each Arkansas county's case rates in the last 2 weeks. Counties in red had increases in rates, while counties in green had declines. 6 counties had a growth rate greater than 100%. A growth rate of 100% represents a doubling of cases in 2 weeks. These data, combined with the data on the previous map, suggest counties in the Northeast and Southeast had rapid growth in cases in the last 2 weeks. This is especially true of counties such as Desha, which has a change rate of 221% and a per capita rate of 136 cases per 10,000 population. These figures strongly suggest the state should expect a surge in hospitalization from these counties in the next 4 weeks. As shown on this slide, the 60 days model forecasts 257,000 879 cumulative cases by February 15th. If this holds true, Arkansas will add 68,681 new COVID cases in the next 2 months. However, our expectation is that this number is a conservative forecast. Current short-term trends suggest the number of new cases will likely be higher. This slide shows the 15-day forecast of COVID-19 hospitalizations in the state on December 28th. The estimated trend in hospitalizations is consistent with the increasing trend in COVID-19 cases in the state. The 15-day model forecasts there will be 10,951 cumulative hospitalizations in Arkansas by December 28th, an increase of 938, or almost 10%, over the number of hospitalizations through December 13th. Likewise, the 15-day model is forecasting 3,375 cumulative intensive care COVID-19 patients by December 28th, an increase of 198, or 7%, over December 13th. We should expect approximately a fourth of people hospitalized for COVID-19 disease in the state will require intensive care. As shown on this figure, there will be new hospitalizations in every age group in the state in the next 2 weeks. The 15-day model is forecasting the greatest number of hospitalizations will be in adults 60 to 74, increasing by 342 new hospitalizations. There will also be increasing hospitalizations in children under 17 years. Pediatric cases will increase by 10%. The map on this slide provides the COVID-19 hospitalization rate per 100,000 residents for each county in the state. All but 9 counties have hospitalization rates greater than 200 per 100,000 population. 14 counties have rates greater than 500 hospitalizations per 100,000. To put it another way, in these counties, 1 of every 200 residents has been hospitalized for COVID-19. The 15-day model is also forecasting 3,108 confirmed deaths in Arkansas due to COVID-19 by December 28th. The forecast is an increase of 412, or 15%, over deaths reported to the Arkansas Department of Health on December 14th. We do not have access for probable death data, so we cannot model the entire number of deaths in Arkansas in the next 2 weeks. However, if we consider a 15% rate of increase applies equally to probable deaths, we add another 60 deaths, resulting in a forecast of 472 deaths in the next 2 weeks. While we have seen fluctuations in the forecasts and projections in the past weeks, the takeaway message from each of the College of Public Health's COVID-19 forecasts has remained the same. All I can do is reiterate our conclusions. The models strongly indicate Arkansas is entering a difficult time. The state is likely to be challenged in a number of ways, from treating people who will be hospitalized to mobilizing the public to continue to practice mitigation behaviors until the vaccines can be effectively distributed. Numbers, especially large numbers, which is what the pandemic may seem to many people, are difficult to grasp. But the reality of large numbers is that they can become all too real very quickly. As public health experience has taught us, abstract numbers become real when someone we love becomes seriously ill or dies from a disease. In many respects, all that can be said about the seriousness of COVID-19 and the impact it will have on the people of Arkansas has already been said. All the words conveying caution, urgency, or seriousness have been spoken or written by us and other public health officials. It will not be surprising if, within the next months before the vaccine is widely available, we have daily reports of over 4,000 COVID-19 cases and 119 deaths. Right now, we are losing 40 Arkansans every day to COVID-19. That reality should be enough for everyone to be aware and to practice COVID-19 prevention behaviors. Be a responsible citizen. Protect your family, yourself, and your community by wearing a mask and staying home as much as possible. I will see you in January for the college's next report. We in the College of Public Health wish all of you a very happy winter holiday, however that may be celebrated by you, and the very best in 2021.